falling shows up more often than you would like to admit. One bad fall can take away your independence in a single day, and walking alone cannot protect you from that. From around 50, your body begins to lose muscle every single year. If you do not train it the right way, that loss turns into weak legs, stiff joints, a hunched back, slower reactions, and that uneasy feeling that you must hold on to furniture or walls to feel safe. The hard truth is this: walking mainly helps your heart and your mood. It barely touches the powerful muscle fibers and deep stabilizing muscles that actually keep you standing, steady, and safe. But there is real hope. Even in your 60s, 70s, and 80s, your body can still rebuild strength and balance with just a few focused minutes a day. In this video, you will discover 6 gentle, low-impact exercises that can transform the way you move and feel. If this speaks to you, please subscribe and turn on the notification bell so you never miss these vital lessons. Exercise 1. Wall push-ups. Wall push-ups are one of the most complete, safe, and transformative exercises for older adults when the goal is to restore posture, functional strength, and respiratory health. With age, the shoulders tend to droop, the back becomes rounded, and the chest collapses. This is the result of weakness in the core and postural muscles, stiffness of the rib cage, and a lack of tone in the upper back. This hunched posture, called excessive kyphosis, not only makes you look older, it also reduces lung capacity, alters balance, increases the risk of falls, and speeds up the deterioration of mobility. Wall push-ups act directly on this problem because they strengthen the chest, the shoulders, the triceps, and the stabilizing muscles of the spine, especially the serratus anterior, the spinal erectors, and the transverse abdominis, which are responsible for keeping the torso firm and aligned. Unlike push-ups on the floor, the wall provides a safe angle that allows you to activate your muscles without overloading the wrists or affecting the neck or lower back. This is essential for people with osteoporosis, arthritis, or initial muscle weakness. In addition, the body works as a chain. When you push against the wall, the core automatically activates to prevent the torso from collapsing, and that improves the stability of the body's center, which is the key factor for walking upright, standing for a long time without fatigue, and moving with control. What is interesting is that this type of exercise not only corrects, but also reduces the pattern of bad posture, giving the body a more youthful, safer, and more efficient alignment. But the benefits do not stop there. Wall push-ups also improve breathing, blood circulation, and the biomechanics of daily activities. By opening the chest and strengthening the muscles that support the rib cage, the body regains its ability to expand the lungs with greater amplitude. This is very important because with aging, the elasticity of lung tissue decreases and respiratory volumes become limited. This gets even worse when your posture collapses forward. When this area is trained correctly, the older adult experiences something powerful. They breathe more deeply, oxygenate their tissues better, walk with more energy, and feel less tired. Furthermore, wall push-ups develop a fundamental pushing pattern that is very important for independence. Pushing a door, getting up from a chair, stabilizing yourself when you lose balance, or carrying objects all require this same chain of muscles. As if that were not enough, performing this exercise with conscious breathing, inhaling as you move closer to the wall and exhaling as you push away, activates the diaphragm, reduces tension in the neck, improves the function of the parasympathetic nervous system, and helps reduce stress. That is, this is a single movement that corrects posture, strengthens the body, improves breathing, protects the spine, and restores stability to the older adult in very little time, and without the need for machines, the floor, or impact. Practicing them consistently changes the way you stand, walk, and move, step by step returning safety and dignity to the body. Exercise 2. Calf activation. Calf activation is one of the most underrated but most decisive exercises for health, mobility, and independence after the age of 60. The calf, formed mainly by the soleus and the gastrocnemius, works like a true muscular pump that pushes blood from the legs back to the heart with each contraction. With age, daily movement decreases. The venous system loses efficiency, and the valves in the legs have to work twice as hard to overcome gravity. This promotes the appearance of swelling, varicose veins, nighttime cramps, a feeling of heaviness, and poor circulation. When the calves are weak, this system collapses. Blood accumulates in the ankles, and venous return becomes slow, affecting not only circulation but also oxygen supply to the tissues and muscle recovery. That is why many older adults feel that their legs are dead or have no strength. Strengthening the calves reactivates this natural pump. It improves blood flow, reduces fluid retention, decreases inflammation, and eases the sensation of chronic fatigue in the legs, something that no medication or gentle walk can achieve on its own. In fact, modern research shows that the soleus, when activated correctly, is capable of increasing metabolic energy expenditure, regulating glucose better, and improving venous function, making it one of the most important muscles for the longevity of the lower body. But the benefits do not stop at circulation. Calf activation is essential to prevent falls, increase stability, and reactivate the entire muscular chain of the legs. Every step, every stair, and every attempt to keep your balance depends on ankle strength and the ability of the calf muscles to react quickly to changes in the ground. With age, a dangerous phenomenon appears. The loss of strength and elasticity of the Achilles tendon, along with the reduction of type 2 muscle fibers, the fibers responsible for power, leads to short steps, dragging the feet, and frequent stumbles. When the calves are strong, the ankles become more stable. The brain receives better proprioceptive signals, and the body recovers the balance reflex, which is the first barrier against falls, the main cause of fractures and loss of independence in older adults. In addition, by activating the calves, the entire posterior chain is also activated, including the hamstrings, the glutes, and the spinal erectors. This improves posture, gait, and the ability to walk longer distances without pain. This is a small, simple, low-impact exercise, but it has enormous effects. Better ankles, better circulation, more stability, less swelling, fewer cramps, and a more youthful, fluid, and safe gait. That is why it is called the pump of life, because keeping it strong literally keeps your mobility alive. Exercise 3. Marching in place with high knees. Marching in place with high knees is one of the most complete, safe, and effective exercises for older adults who want to improve the cardiovascular system without impact, regain agility, and train balance at the same time. Unlike walking on the street, where there is a risk of tripping, uneven surfaces, or distractions that create fear, this exercise is performed in a controlled environment. It allows the older adult to lift the knees, activate the hips, and move the arms with greater range, unlocking movement patterns that are lost with age. Each knee lift strengthens the psoas, the hip flexors, and the core stabilizing muscles. These are essential for taking firm steps and lifting the feet off the ground without dragging them, which is one of the most common errors in the gait of older adults. At the same time, the continuous and gentle rhythm raises the heart rate, improving lung capacity, circulation, and endurance without putting stress on the knees, ankles, or hips. This makes it an ideal tool for people who are overweight, have arthritis, osteoporosis, or mobility limitations. In addition, the coordination between arms and legs stimulates neuroplasticity, strengthening the connections between body and brain. This leads to more agile movements, better reaction time, and a more stable and safe gait. This type of conscious cardio also has an emotional impact. It reduces stress, improves mood, and increases the sense of control over one's own body. This is key for those who have lost confidence in walking or who fear falling. But its greatest power lies in how it transforms the biomechanics of gait and the stability of balance. Deliberately lifting the knees forces the body to reactivate the deep muscles of the abdomen, the glutes, and the pelvic belt, restoring stability to the area where all human movement begins, the center of the body. When the core is active, the hips align better, posture becomes more upright, and the spine receives less load. This reduces lower back pain and improves the natural walking technique. In addition, marching in place with high knees trains dynamic balance. The body constantly shifts weight from one leg to the other, practicing weight control, ankle stability, and proprioception, the sense that tells the brain where the body is in space. This is very important because with aging, reflexes become slower, steps become shorter, and the base of support widens in an unconscious attempt to feel safer. But that rigid gait pattern actually increases the risk of falls. By restoring the natural cycle of walking, this exercise returns fluidity, cadence, and confidence. In just a few weeks, the difference is noticeable. The older adult walks with a firmer, longer, more agile step, and with the head held high. With just about 2 to 5 minutes a day, marching in place with high knees not only improves heart health, it also restores youth to movement. Exercise 4. Squat. The squat, or sitting and standing movement, without exaggeration, is one of the most important functional movements to maintain independence and strength at any age, especially after the age of 60. It is the movement we use every time we get up from a chair, the toilet, or the bed. Losing the ability to do it without help marks the beginning of physical dependence. However, over time, muscle weakness, loss of hip and knee mobility, and the fear of pain or falling cause many people to stop practicing this very natural movement. What few people know is that avoiding it actually speeds up deterioration. When it is not trained, the muscles of the lower body, especially the glutes, the quadriceps, and the core, lose tone. The joints become stiffer, and balance weakens. The squat, by working large muscle groups at the same time, is the best natural antidote to muscle atrophy because it stimulates both fast and slow muscle fibers, improves bone density, activates the hormonal system, and boosts metabolism. Unlike many other exercises, the squat is completely functional. Each repetition teaches the body to move with control, to align the spine, to maintain core stability, and to transfer strength from the legs to the rest of the body. Performed correctly, the squat becomes a complete training tool that re-educates movement, protects the knees, reinforces the hips, and restores confidence when standing up. But beyond strength, the squat brings back something much more valuable. Through this exercise, the connection between the body and the brain is strengthened, improving coordination, proprioception, and dynamic balance, which are three fundamental pillars for preventing falls, the main cause of fractures and loss of independence in older adults. Studies in the physiology of aging have shown that integrating squat exercises, even with simple body weight or using a chair as support, significantly improves bone mineral density, walking speed, and reaction capacity when facing stumbles. In addition, by involving breath control and deep abdominal activation, it also strengthens the core, stabilizes the pelvis, and reduces lumbar pressure, which leads to a more upright posture and safer walking. Practicing it progressively, starting with a chair or with wall support, is completely safe, and performing it regularly promotes more efficient blood flow in the legs and hips, helping to prevent morning stiffness and joint pain. The key does not lie in the number of repetitions, but in the quality of the movement and in doing it with awareness, with firm feet, controlled breathing, and abdominal activation. With just about 5 to 10 minutes a day, the squat becomes a powerful tool to maintain strength, mobility, and dignity, because it is not just about training muscles. It is about training the freedom to move without fear, to stand up by yourself, and to continue enjoying life with energy and safety. Exercise 5. Glute bridge. The glute bridge is one of the most powerful, safe, and transformative exercises for older adults because it strengthens the posterior chain. This includes the glutes, the hamstrings, the spinal erectors, and the deep core muscles, which act as a real protective shield for the lumbar spine. With age, a sedentary lifestyle, too much sitting time, and progressive weakness caused by muscle atrophy create a vicious circle. The glutes turn off, the pelvis loses stability, the lumbar area begins to compensate, and pain appears as a result. This pattern is so common that today it is called dead butt syndrome, a condition in which the glutes no longer perform their main functions. These functions are stabilizing the hips, absorbing impact, and protecting the spine when you walk, get up, climb stairs, or simply stand. The glute bridge reverses exactly this process because it reactivates the gluteus maximus, the largest and strongest muscle in the human body, and awakens the deep muscles that are responsible for supporting the pelvis. By lifting the hips against gravity, muscle fibers that are rarely activated in daily life are stimulated, improving tone, circulation, and endurance. But its benefits are not only local. By strengthening the posterior chain, the body recovers its natural alignment, reduces pressure on the lumbar discs, improves posture, and reduces excessive lordosis and stiffness that so many older adults feel when they wake up or stand for long periods. This exercise also activates the core without the need for abrupt movements, which makes it one of the most effective and safe tools for those who are afraid of getting hurt, use a back brace, suffer from recurrent lower back pain, or feel weakness in the lower back. The impact of the glute bridge on daily life is remarkable because it strengthens the muscles that most influence functional independence, walking stability, and fall prevention. When the glutes and the deep core work properly, the hips stop moving in an unstable way, the steps become firmer, and the body recovers the ability to generate strength from the center, which is essential for every human movement. In addition, improving the function of the posterior chain also increases proprioception, which is the brain's ability to detect the position of the body. This speeds up reaction time when facing a stumble and protects the older adult from the main cause of fractures, the fall. From a metabolic and circulatory point of view, the glute bridge promotes venous return, relieves tension in the lower back, and reduces inflammation caused by years of poor posture or muscle weakness. Even breathing improves, because by strengthening the deep core and opening the anterior chain, the diaphragm works with greater freedom. This increases oxygenation and the ability to walk longer without fatigue. With just about 5 to 10 minutes a day, the glute bridge not only reduces lumbar pain but also restores the natural movement of the body. It gives firmness back to the hips, stability to the gait, protection to the spine, and a more youthful energy when getting up, sitting down, walking, and living. That is why in modern rehabilitation and longevity programs, this exercise is considered a pillar because it not only strengthens but also restores independence. Exercise 6. Lateral leg raise. Lateral leg raises are one of the most strategic exercises for older adults because they strengthen a muscle group that almost no one trains, but that determines body stability. These are the hip abductors, especially the gluteus medius, the muscle responsible for maintaining balance while walking, stabilizing the pelvis, and preventing the knee from collapsing inward. Over time, and especially after the age of 60, this muscle tends to atrophy due to a sedentary lifestyle and the natural loss of muscle mass, known as muscle atrophy. When the gluteus medius weakens, a chain reaction occurs. An unstable gait appears. The pelvis sways. Lateral hip pain, which is very common in older adults, increases. There is overload on the knees and ankles, and the probability of stumbling and falling rises. In fact, biomechanical studies show that the gluteus medius acts like the body's airbag, stabilizing the leg every time we take a step. This muscle fires in milliseconds to prevent us from losing our center of gravity. But if it is weak, the brain loses that automatic response, and balance decreases dramatically. Lateral leg raises reactivate that forgotten function because they isolate the movement, awaken the mind-muscle connection, and strengthen the deep stabilizing fibers that are not activated when walking. At a neuromuscular level, this exercise improves proprioception, the ability of the body to locate itself in space, and trains lateral control, which is the most forgotten axis of balance in human movement. Walking moves the body forward and backward, but most falls in older adults occur to the sides. Therefore, strengthening lateral stability is essential to age with mobility and safety. Its impact on daily life is enormous, because lateral leg raises not only strengthen the hips, but also restore firmness to the gait, improve posture, and re-educate the body to move with control, without insecure swaying or clumsy steps. They also help correct structural problems associated with aging, such as weak ankles, knees falling inward, lumbar overload, and loss of pelvic alignment. At the joint level, this exercise improves hip lubrication and reduces stiffness caused by years of a sedentary lifestyle or mild arthritis. Since controlled movement increases synovial fluid production, nourishes the cartilage, and reduces pain. In addition, by strengthening the gluteus medius, the pelvis no longer drops with each step, allowing a more stable and efficient stride. This translates into greater confidence when walking on the street, climbing stairs, or standing up without support. And there is a key point. This exercise is low impact, safe, progressive, and suitable for almost any condition, which makes it a therapeutic tool used in physical therapy, hip rehabilitation, and modern fall prevention programs. With just about 2 to 3 sets of 10 to 15 repetitions per side, 3 times a week, the older adult can notice visible changes in a few weeks. Firmer steps, better balance, less pain, and a renewed sense of control over their own body. That is why lateral leg raises are not just an exercise to strengthen the legs, they are an antidote against frailty, insecurity while walking, and the fear of falling, the fear that steals the most freedom after the age of 60. In addition to the individual benefits of each exercise, what is truly powerful happens when they are combined in a progressive routine. The squats, the glute bridges, the lateral leg raises, and the other movements you have seen work together to activate what science calls fundamental movement patterns. These are the gestures that the human body needs to remain autonomous. Pushing, pulling, stabilizing, extending the hips, bearing load, and maintaining balance. Many studies show that after the age of 50, what most deteriorates quality of life is not age itself, but the accumulated loss of muscle mass, sarcopenia, and neuromuscular strength, which affects balance, posture, endurance, and joint function. These exercises attack the problem at its root. They activate the glutes and the core, the engines of longevity, strengthen the stabilizing musculature of the hips, reduce pressure on the spine, re-educate the gait pattern, improve proprioception, and reprogram the body to move with greater efficiency, elasticity, and control. In other words, they do not just build muscle. They restore human movement, giving back agility, walking safety, and the ability to climb stairs, squat down, get up from the floor, or carry weight without fear or pain. This type of training, when practiced consistently, has an impact that goes far beyond the physical. It improves brain oxygenation, reduces systemic inflammation, stabilizes blood sugar, reduces the risk of falls by up to 50%, and activates metabolic pathways related to longevity, such as EMPK and mTOR, in the right measure. The most interesting thing is that the body responds at any age, even after 70 or 80, because muscle is a tissue that can adapt for life. That is why every repetition counts. You are teaching your nervous system to move better, reinforcing your skeleton from the muscles, and creating an independence insurance for your future. Do it with intention, with patience. Your body does not want to age in a fragile way. It only needs the right stimuli to awaken its true potential. In this way, aging does not have to mean losing strength, balance, or freedom. You have seen simple, effective, and scientifically proven exercises that can change your body and your life if you practice them consistently. This is the moment to choose: to keep letting time decide for you, or to take control and build a strong, stable body without fear of movement. Do not wait until you feel pain, depend on someone else, or limit your life. Start today. Give this video a like, subscribe to the channel, turn on the notification bell, and save this content. Practice this routine and join me on the path toward an active, independent, and energetic older age. Your best version did not stay in the past. It is right in front of you, and it begins with the first repetition. Your body and your health will thank you.